At York Region, our first priority is the health and safety of our residents, staff, and community. During COVID-19, it's important to adhere to provincial, federal, and local public health advice and guidelines to keep our communities, and one another, healthy and safe. Under the Occupational Health and Safety Act, employers must take precautions to keep workers safe, including keeping them informed, creating policies and procedures, and ensuring workers use the right protective equipment. Wherever you work here in York Region, we have some useful information and tips on how to stay healthy and safe at work. It's important to keep in mind that we're constantly learning about COVID-19. The information in this resource is the most accurate as of the end of May 2020. Please continue to visit ontario.ca and the Ontario Ministry of Labour for provincial news and updates, as well as york.ca for York Region-specific information and resources. As we work our way through this resource, we'll be covering COVID-19 and self-assessment, physical distancing, washing, cleaning, and disinfecting, and reporting health and safety concerns and exposures. Let's begin by taking a look at COVID-19 and self-assessment. Coronaviruses are a large family of viruses that originate in animals but are known to cause respiratory illness in humans. Rarely, these coronaviruses can infect people. Even more rarely, they can spread from person to person through close contact. COVID-19 is a new coronavirus that has not been previously identified in humans. There is no vaccine or cure. With no vaccine and no cure, it's important to break the chain of transmission by following public health advice and measures. Current evidence suggests that COVID-19 is mainly spread from person to person. This can be between people who are in close contact with each other, less than 2 meters or 6 feet apart, or through respiratory droplets when an infected person coughs or sneezes, which can then land in the mouths, eyes, or noses of people who are nearby. There is no evidence at this time to suggest the virus can be spread through the air. Although less common, COVID-19 may also be spread from contact with contaminated surfaces or objects. This can happen when a person touches something that has the virus on it and then touches their own mouth, nose, or eyes with unwashed hands. Virus droplets may remain infectious for several hours on surfaces, depending on where they fall. Viruses generally remain active longer on stainless steel, plastic, and similar hard surfaces than on fabric or other soft surfaces. Proper hand hygiene and cleaning and disinfecting frequently touched surfaces can help eliminate this type of spread. The symptoms of COVID-19 range from mild to severe, like the flu and other common respiratory infections, and can include the following: fever, or a temperature of 37.8 degrees Celsius or greater, new or worsening cough, shortness of breath, sore throat, difficulty swallowing, new smell or taste disorders, nausea or vomiting, diarrhea, abdominal pain, runny nose or nasal congestion unrelated to seasonal allergies, postnasal drip, and similar nasal symptoms unrelated to any other health condition. It's important to stay up to date on the symptoms of COVID-19. Please refer to the Ontario Ministry of Health's website for additional symptoms that can impact children, and be sure to visit york.ca regularly as new information often becomes available. You should self-assess regularly for symptoms of COVID-19 before entering any workplace or if feeling ill during the day. If you're symptomatic, self-isolate. This includes both you and your close contacts. Seek assessment at a COVID-19 assessment center. Connect with the appropriate people at your workplace. Every business will have its own process. In York Region, there are assessment centers located at our 3 hospitals: Markham-Stouffville Hospital in Markham, Mackenzie Health in Richmond Hill, and Southlake Regional Health Centre in Newmarket. Information on these centers is available at york.ca/COVID-19. If you have any severe symptoms, such as difficulty breathing or chest pain, call 911 right away. You're required to tell anyone you've had close contact with, from 48 hours before your symptoms started until you started self-isolating, and advise them to contact their healthcare provider. To better understand who we consider close contacts, our contact tracing team looks at any person who meets the following criteria and who was with the person who tested positive for COVID-19 within 48 hours prior to that individual becoming symptomatic, a person without personal protective equipment, or PPE, who was within 2 meters or 6 feet of a person with COVID-19 for 10 minutes or longer, or who has come into direct contact with respiratory secretions of a person who has COVID-19. Some examples of close contacts can include people you live with, people that provide physical care for you, for example, bathing, feeding, or toileting, or that you provide care for, friends you visited with, intimate partners, or coworkers that you spent time with. To help break the chain of transmission, it's a good idea to keep a journal to track your daily whereabouts, including where you went and the names of people you interacted with. For more information or questions about COVID-19, you can also reach out to your healthcare provider, Telehealth Ontario at 1-866-797-0000, or York Region Public Health at 1-800-361-5653. Take the following steps to help prevent the spread of respiratory infections, including COVID-19. Wash your hands thoroughly and often with soap and water, or use alcohol-based sanitizer if you can't wash your hands. Cough or sneeze into your sleeve, or cover your mouth and nose with a tissue. Throw the tissue out immediately afterward and wash your hands. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home if you're sick. Avoid sharing personal items like eating utensils and water bottles, and frequently clean and disinfect high-touch surfaces. Where physical distancing cannot be maintained, and where no personal protective equipment is required, York Region encourages people to wear their own non-medical masks or face coverings. 2-layer cloth masks appear to not only protect other individuals from us if we are infectious, but they may serve to protect you from others if they are infectious. You can find more information about face coverings on york.ca. Face coverings alone will not prevent the transmission of this virus. You must continue proper hygiene, physical distancing, and avoid touching your mouth, nose, and eyes. We've heard a lot about physical distancing. What does it actually mean? In line with federal and provincial recommendations, all Canadians should be practicing physical distancing behaviors to help stop the spread of COVID-19, at work and when out in public. This includes maintaining a distance of at least 2 meters or 6 feet from others, and taking steps to limit the number of people you come into close contact with. Some of the ways we can achieve physical distancing include calling, emailing, or instant messaging your colleagues, and using technology to meet and share documents virtually versus in person. Implementing and following physical distancing measures for workstations, meeting rooms, hallways, elevators, and washrooms, including one-way only travel in narrow corridors and stairwells. Avoid gathering in hallways or other areas of buildings where 2 meters of space, or 6 feet, cannot be maintained. York Region has implemented and posted capacity limits to help people navigate through York Region facilities safely. Our employees are asked to adhere to the signage as posted. This is a measure businesses may wish to explore as well, if not already. These signs can be customized to suit your business and be included in meeting rooms, elevators, and washrooms where physical distancing may be difficult. Implementing physical distancing in hallways and stairwells can be difficult. York Region has one-way only travel signs in narrow corridors and stairwells. Other options to limit too many people in small spaces or narrow halls is staggering staff start and break times. Washing, cleaning, and disinfecting is an important part of preventing the spread of viruses like COVID-19. The first line of defense is to always wash your hands thoroughly and often with soap and water for 20 seconds. Don't forget to wash your wrists, under your fingernails, and between your fingers. Use alcohol-based hand sanitizer when soap and water are not readily available. This includes when you're first entering your workplace for the day and when you're leaving at the end of the day. Cleaning and disinfecting shared spaces is incredibly important in preventing the spread of COVID-19 and other viruses. Hand sanitizer and disinfecting wipes should be used as required each day. Follow instructions when handling the wipes and be sure to wash your hands with soap and water for at least 20 seconds afterward. At regional offices, our team has enhanced our cleaning and disinfecting practices. Businesses should do the same to help limit the chance COVID-19 will be transmitted in the workplace. To keep workspaces as germ-free as possible, you're asked to use disinfectant wipes on your workspace, surfaces, phone, keyboard, and mouse. In addition to our workspace, we also need to remember to keep our mobile devices clean. Turn off your device before you clean it. Use a microfiber cloth and an isopropyl alcohol-based cleaner to gently wipe your device. Wipe your display screen in one direction, moving from top to bottom. Allow your device to air dry before turning it back on. Some cosmetic changes to finishes may occur from cleaning your device. You may wish to contact your IT department or manufacturer for more information. Keeping your vehicle clean is an important part of practicing good hygiene and helping to stop the spread of COVID-19. You can help protect yourself and others by increasing the cleaning and disinfection of your work or personal vehicle. Be sure to clean frequently touched areas like your key fob, door handles, both inside and outside, seat belts, steering wheel, gear shift, armrest, dashboard, and vehicle controls. When you're cleaning, keep doors open to clear out cleaning vapors and any possible virus that may be in the air. Under the Occupational Health and Safety Act, employers must take precautions to keep workers safe, including keeping them informed, creating health and safety policies and procedures, and ensuring workers use the right protective equipment. Employees concerned about the safety of their workplaces can call the Ministry of Labor's Health and Safety Call Center at 1-877-202-0008. At York Region, the health and safety of our employees remains a top priority. Among other practices, we also have dedicated bulletin boards at all of our locations to display health and safety information. Some of this includes health and safety policies, the rights, roles, and responsibilities for workers, supervisors, and employers, Ministry of Labor contact information, Joint Health and Safety Committee member details, and monthly workplace safety inspection reports. It's everyone's responsibility to adhere to measures outlined by the federal and provincial governments and public health. Let's all do our part to keep ourselves and others safe. Remember, information on COVID-19 is changing daily. Visit york.ca/COVID-19 regularly for the most accurate and up-to-date information. Please be sure to also visit the provincial government's website regularly, ontario.ca, as they lead Ontario's response to COVID-19.